Okay, hello, my name's Richard Hobbs. I'm a representative for Somerset Parent Carer Forum. I'm here today with Tanya Camberwell and Sheila Burridge from Healthwatch Somerset. They're going to be giving a presentation on what Healthwatch Somerset does and what they are. And what we will do, we will record this session so that it can go up onto the Local Offer website and also on the Local Offer YouTube channel. So anybody that misses this will be able to see it from there. After the presentation, I will turn off recording, and anybody that has any questions will be able to ask them in the chat. If you have any questions during the presentation, then feel free to ask them if you're comfortable with it being recorded at the same time. And afterwards, I will ask a quick survey through the Mentimeter app, which I will show you via sharing my screen, so that you can give your feelings and thoughts on the presentation and whether you would like to see more of this type of thing in the future. Okay, I shall hand you over now to Tanya and Sheila. Thank you.
Good morning, everyone. We'll just bring up our first slide. There we go. Let's get that into, oops. And hopefully, there we go. Okay, so we're here today from Healthwatch Somerset. My name is Tanya Camberwell. I'm the Engagement Officer.
And my name's Sheila Burridge, and I'm the Volunteer Officer.
And Sheila's going to present the first couple of slides for us.
So our first slide really is a summary of what Healthwatch does in 1 minute. So we're just going to play a quick video for you, which hopefully explains what we do.
We have no sound, Tanya.
I do apologise. There's no speech, just music.
So what we do at Healthwatch, we provide opportunities for local people to have a voice. We go out to people, families, carers, and ask and understand what matters to them. We're interested in everybody's views from all parts of the community. Last year, we heard from 1,689 people, and we provided advice and information to 698 people. We work to get services right for the future. We're able to challenge those who plan, pay for and deliver health and care services. We make reports and recommendations about how local health and care services could or ought to be improved. We're a small staff team. So there's Tanya and myself, and then we have Karen, our team administrator, and Jill, our team manager. So we're very reliant on our volunteers to help us carry out our work at Healthwatch. We have 34 volunteers who help us carry out our work. And they help us with lots of things, and a few examples are, there are our ambassadors in their local community. They go out to listen and collect feedback, for example, by having a stall in their local library. They distribute promotional material in their area. They talk about Healthwatch at local groups. They contribute to our projects and conduct surveys and consultations.
Okay, so back to me. Just to let you know that you might be thinking, well, I haven't seen my doctor in the past year, so I don't need to or have anything to feedback. Healthwatch Somerset look at all the health and social care services in Somerset that receive money from the public purse. So any of the services you see on your screen, if you use or have experience with any of those services, we want to hear your views. And Healthwatch Somerset like to hear good experiences. We're not just a service that takes in people's bad feedback, and we are independent. So people can come to us and feedback about a service that they've used and know that they're not necessarily going to get blacklisted. Not that anybody ever should do, but it is a very understandable concern. People prefer to feedback to an independent service rather than the service itself. And there's nothing wrong with that. The service that you feedback about will receive that feedback, but it will be anonymised so that they won't know who it's been given by. Our feedback is also seen by the people who commission the services, the people who fund the services, and the people who regulate the services. So it doesn't just stop with us. And it also goes to our umbrella company, Healthwatch England, who collect all the feedback from the local health watches around the country, and they identify any major national trends, and they can also campaign at a more national level. So, for example, we've had a lot of feedback about dentistry in Somerset. This is actually a problem that is a national problem, and Healthwatch England have been lobbying MPs and government and the regulators and commissioners about this issue to try and get it resolved. There was some additional funding announced by the government earlier at the back end of January, and some of this has come from the feedback from Healthwatch England, and that's everybody's feedback around the country. So we're really grateful for people letting us know about their good and bad experiences accessing dentists or when they're at the dentist within Somerset. A very brief update about some of the work that we've done. So in June 2021, we published a report about the district nursing service in Somerset. We sent out over 2,500 invitations to people who use the district nursing service. Now, we did this through the district nurses themselves. So they hand delivered to people invitations during their visits to 2,500 people, asking them to join in our survey. It was a really interesting survey, and it is helping the district nurses to improve their accessing hours. So they're looking at maybe extending appointments into evenings where people are happy, and also at weekends. We also discovered that there wasn't actually any real appetite for digital appointments where appropriate. Obviously, there's a lot of services that the district nurses deliver that wouldn't be able to be done online. So it was only maybe a video consultation where appropriate. We have also had our Young Listeners Project. They published a report in November 2021, and this was asking young people about their experiences of health and social care. All of our reports are available for free download from our website, or you can read them online or you can print them off, absolutely totally free. We had some really good feedback from the young listeners, and I do have a quote from Fiona Purr, who is the business manager at Somerset County Council, who works with youth services, and I'll put that up on the next slide. And finally, we also published in November the impact of waiting for NHS surgery in Somerset. And we asked people who were waiting for surgery to tell us about how their experience of waiting was. The recommendations that we make at the end of every report for the impact of the waiting for surgery have already been taken up by Somerset Foundation Trust and Yeovil District Hospital, and we are working with them on some of those recommendations to ensure that the people waiting for surgery are getting a better waiting experience from now on. So just back to the young listeners report, the comment from Fiona Furr was that young people's voices should be at the centre of all our decision making. And the findings from this project are powerful and give direction to future service planning. Well done to Healthwatch Somerset and the young people and everyone who supported them. So that's quite a prominent person within the council who has a great influence upon the delivery of certain children's services. And that's a really positive feedback from them themselves. Again, we are working with them around our recommendations. The public also feedback to us over the phone or through our website. You can go online and fill in a form for free, or you can give us a call for free, and our lovely team admin Karen will be able to help you. She will either signpost you or send you some information. We record that feedback again anonymously, and this is just an example of the kind of feedback we have received since October through to December last year. As you can see, our highest number of feedback comments surround GP practices, although it's nice to see that they have more positive comments than they do negative comments. However, as you can see there, non-hospital dentists are our next highest feedback, and we didn't receive, sadly, any positive feedback during this time. Again, that does reflect a national problem, and the changes that need to occur to make this better do have to happen at a much higher government and commissioning level. But do please keep giving us your feedback about NHS dentistry, because it will always support the fact that these services are still needing more support and are still not actually serving the public the way that they should be. Here's another comment from the NHS Clinical Commissioning Group, and this was given in response to our referral to treatment report. And as you can see, it says this report has given Somerset healthcare providers valuable insight into the impact that long waiting times can have on our patients within the system. It has shown there is a need to improve communications, ensuring regular updates are given. And that comment just brings out one of the highlights of the report. The people who responded to that particular survey, one of the overwhelming themes that came out was that they hadn't been communicated with by their specialist or the specialist department since the COVID lockdown in 2020. So when the first big wave of COVID happened, obviously all surgeries stopped so that the people involved could help other elements within the NHS deal with the COVID crisis. However, from an administration point of view, the people who were waiting for surgery didn't get even a message to say, you're still on our waiting list, we know you're there, we're sorry, things are difficult at the moment. So they've taken that on board. They appreciate that the communication needs to improve, and they're already working towards measures that will make sure that that improves for the future. So that's our presentation today. If you would like to get in touch with us, you can do so either through our website, which is healthwatchsomerset.co.uk. There are tabs along the top where you can select giving your feedback, and you can give that online. Or you can call us for free on our 0800 number. Some of our materials out there do have a 01278 number attached to them. This number is the old Healthwatch Somerset number. It will still come through to our phone line, and it will be free like the 0800 number. So if you've only got the old number to go by, it's still free for you to call us. Obviously, we always like to hear comments on our social media posts. However, we won't necessarily respond directly to any signposting feedback or feedback about surgeries online. We will contact you privately through private messaging to do that. So if you want to feedback to us, social media isn't the best platform, but please feel free to make any comments on our posts that you feel are appropriate. So thank you very much for listening to us today. That's the end of our presentation. And I guess the next section is if anybody has any questions about what we do. Thank you very much.
Right, and I shall thank both Tanya and I've forgotten your name, Sheila, for that presentation for us, and I will now stop recording the session.